Good evening, friends. So today our remedy is calcarea sulf. Uh, like previously, we used to overprescribe calcarea sulf. Like when we used to come to calcarea, if patient is hot and skin is the presentation, we used to give calcarea sulf. Lot of suppurative tendencies with calcarea, we used to go to calcarea sulf. So there were a lot of easy prescription before. But as we are studying calcarea self more and more, and with proving, reproving, even mental data is getting bit cleared. If you see the old literature, like in Kent and all, very minimum mind symptoms are given. Although irritability, jealousy, sadness, these symptoms are given in Kent's, but you don't get the clarity of calcarea self. So just let's study this calcarea self through the cases. I have prescribed one patient with the mind and physical data, and Aditi has also prescribed through the synthetic prescription. So let's understand calcarea self through various ways. How thermals are important, how skin presentation is important, how mind is important, and how the particular data is important. So with these all bigger remedies, every data is important. So let's understand about this case. So this child had come to me when he was 13 years old, and he recently shifted to Mumbai. He had a lot of mosquito bite allergy, and he used to catch secondary infections. So there was tendency for suppuration. But before that, there was excessive itching, lot of itching, and after scratching, there will be secondary infection, and then the tendency for suppuration. Characteristic of this case was it used to leave lot of pigmentation, blackish post-inflammatory pigmentation. So his whole body was covered with blackish pigmentation. There was not much data more than this, but he was always been taking treatment for allergic dermatitis, and he was always been taking treatment from homeopaths and was responding well. This time when he came, there was change. He came to Mumbai, so place has changed, schools have changed, everything has changed, and his allergy had gone up, and there was lot of itching. Mother was giving all the information about the child. Father was sitting quietly, and this boy was appearing bit agitated with the conversation. He didn't like what is going on in the session. So history went like this. Mother said, this problem is there since when he was quite young, and especially she remembers when he was 6 years old, they had shifted to a new place. And that place was bit harsh, like people were quite aggressive in this place. So this boy took long time to adjust in this area. Other children used to bully him. They used to tell him, if you'll not give me your tiffin, I'll not be your friends. If you'll not give your pay, I'm not your friend. So every time this child used to come home crying. Then by 6 years, his vocabulary was not very clear. Few words were difficult to talk, like in Hindi we call the, which he was finding it difficult. The was difficult. So children used to make fun about it. Physically also he was bit dark and bit a masculine body. So for that also children used to tease him. So this child was really very disturbed that time. Mother was also going through her share of difficulties. Like it's a new place. Her in-laws stay nearby in this place. She was expecting their help, but no one could come forward. And the COVID lockdown happened. And now with a young small child, she was finding it difficult to handle. And child was also going through these allergy issues. On the top of that, mother became pregnant and she was going through a lot of nausea, vomiting difficulties. And she did not get any help because it was a lockdown. And she was sharing all this information with lot of crying that how I suffered during pregnancy and no one came. to help us. And then the second child came with the lactose intolerance. So there is additional difficulty in this lockdown. So what happened? The whole attention, because the young child was quite sick, and the whole attention went to that child. And because of that, this child became very, very angry, irritable. He used to back answer mother, "You don't love me. You are not taking my care." And but he used to be very mild, soft in front of father. He cannot react back when father is around. So this child used to get irritated on younger child, but he was not allowed to do anything. On the top of that, sometimes younger child used to hit him back. But he said, even if he hits me, I'm not supposed to hit him back. He was complaining about his parents. How brother is at fault and I'm not. Still, they shout at me. So he was complaining about his parents. So only this much data. Child said while this conversation that they don't allow me to react, but he hits me. He does everything. But parents, they don't tell him anything. In frustration, sometimes mother used to hit him, sometimes father used to hit him, and the things went on increasing. His allergy went on increasing, his pigmentation went on increasing. The difficulties within family went on increasing. Child is very good in sports. He likes to play football. He likes swimming. He loves too much. And what's going on? Child appear very disturbed that mother is talking about him, how he loses temper, how he shouts. But then there was nothing. So this was the data. And on the physical examination, a lot of blackish pigmentation, and it is very, very evident on extremities. Bit dark child. Thermal was not very clear, ambithermal child, and not very clear craving, aversion. I didn't got any other data, but only this data was available. And from this data, because there was a history of abuse, there was a history of fear, there was history of like in front of mother, he was reacting back, but in front of father, he used to be timid child. So with this all history, I did thought of calcarea. And then sulfur from physical data was not very difficult. And but very what attracted me was the only two sentences during history. He said, even if my younger brother does wrong, they shout at me. They don't shout him. They always blame me for everything. And the history which speaks that younger child came with the lactose intolerance and whole attention went there. From that, I could take the rubric sibling rivalry. But more than that, there is a rubric jealousy in children. And in these 6 to 7 remedies are there, and out of which one very characteristic is calcarea sulf. And when I studied calcarea sulf, I realized there is a lot of jealousy when they do not get attention. If someone takes away the attention, they feel really very insecure. With that, if skin complaints come, and then child keeps talking about his dissatisfaction, when they like in this also child said they do this with me but not with younger one, so he was complaining about his parents. So there is a very characteristic rubric is lamenting. With these three rubrics, I prescribe calcarea sulf, and in few doses patient felt much better. After that, approximately 3 to 4 months, they shifted to new area. From there, again, they came after maybe 2 3 months that again there was some difficulty. So child was getting irritated that time a lot because again adjusting to new environment was becoming difficult. But there was no skin difficulty. His pigmentation was settled. His itching was not there. So all other symptoms were better, but only irritation came in this new environment. And that time again, single dose was prescribed and patient settled down. So what I thought about Calcarea self in this case, which gave such a good result, was constant feeling that I'm not appreciated, I'm not valued. Continuously, he was feeling the parents are now attending the younger one, and I'm not getting my due share. And with that, he was complaining completely. So there was rubric lamenting, bemoaning, wailing. Appreciated, he is not. And jealousy within family is the rubric. So anyone else, if takes that attention, I feel insecure, I feel jealous about that person, is the rubric. And with that, all other symptoms of physical data I considered. And with that, Calcarea Sulf was very clear. And I prescribed Calcarea Sulf 200, and patient is all right with that. And with this, we will share one more case of Calcarea Sulf. Aditi will share how she prescribed Calcarea Sulf with the understanding of Calcarea and understanding of Sulf. Uh, so we'll understand Calcarea Sulf from various perspectives, because sometimes you will get very clear understanding of physical data, sometimes clear understanding of Calcarea, sometimes clear understanding of characteristic particular. So I invite Aditi. So Aditi,
Yeah,
share this.
yeah, Nirupama. So, as we saw in Nirupama's case, there were certain rubrics, very peculiar and prominent rubrics, and through which the whole case opened very nicely. And then, as she explained the whole case, the calcareous self ultimately cured the patient. So, in my case, what was happening was that she is a 52-year-old lady, and she had come to me with multiple irregular warts. Now they were blackish warts, rough warts on fingers, toenails, on face. Since quite some time, since years it was going on. And she had actually got one surgical one wart surgically removed also from the face. And again it had started reappearing. That had happened 5 years back. Now, when I was going into detailed history, so I said, "What is your concern and why you want the treatment now? You had already removed it once." So she said that I avoid medicines, but now everything has started growing again, and I thought now I need to address this problem. So then I was trying to understand her life space, and in that she is living with her in-laws who are 80 plus, both the in-laws, also one unmarried sister-in-law, and her own two children, own daughters, and husband. Now, when she was talking about all these things, when she came to me for the first time, she was very friendly in nature, very communicative, very friendly, and pleasant talking, and very free in talk. So I could sense these things in her, and she's little plump and all. So then when I was asking about her, she said that I don't have much anger in my nature, mildly smiling and talking. And I let go. I maintain my relations with people. I like to respect people. See, what I always give importance is when I allow patients to talk, I ask very, very few questions. And then every word what they use, I give a lot of importance to it. Because like some people can, why a person has to use the word respect and not some other word, not like people or love people, and why respect people. So I give these words quite a lot of importance when I feel that is a vital force language talked.
Yes.
Yeah. So she said, I like to respect people. If someone hurts, I don't show it outside, but that respect is gone for that person, and I cannot accept them from inside. I don't like people playing games. I am very straightforward person. I don't like manipulations. I don't like hypocrisy. Be straight with me. Then she was talking about her religiousness, her rituals, and all. Then other about her other interests and hobbies. She said, "I like singing, painting, creative art." And about that, she said, "It should be unique. That's my choice. It has to be unique, whatever I am doing." A family oriented person. Then again, it is repeating. I don't like flattering, buttering people. Uh, I have good rapport with everybody. I get about fears and anxieties. She said, I get palpitations when I am anxious. I said, what makes you anxious? She said, I really don't know that, but it happens. These palpitations are happening nowadays. And it used to happen before very rarely. Now it is happening frequently. So I associated it maybe with menopause because she has come to me at the age of 51 years. Then she said, before I could do a lot of things, now I have slowed down. Okay. Before I was averagely thermal, but now I am distinctly hot. Okay. And this was the case history and case. Now, when I prescribed her first remedy, what happened was warts were as it is, and her umbilical eczema started developing. Now umbilical eczema and started oozing also and started developing and umbilical eczema. She said this complaint I used to have many years back. Again, it has come back. Now we need to see here that is it the old symptoms are coming back only that, or is it something more? Because her warts were not changed at all. So I felt that my prescription was not correct. That is why then I kept trying to understand, and I just gave her a dose of sulfur. After giving sulfur, the umbilical eczema was reducing. The oozing was little better, but not significantly. But the warts were not changing, and warts were increasing. In fact, so I felt that now I need to understand this case little bit more because I felt this is a very layered case and I have to understand her little more in depth. So then I tried and analyzed what she was talking. Then I got this exclusiveness, her physical appearance, then so I felt this is quite a calcarea type of a person. Coming I like family, I like to maintain relation, quite extrovert way of talking, smiling, very easy communicatively, and fears and anxieties and all. So I felt that she is a calcarea type of a person, but I felt that I have to add some more salt in it because there were very distinct two things were happening with calcarea, exclusivity and fears and all. There was also ego of sulfur, which was very prominently coming. So I thought that, and because of this umbilical eczema and all. Now I was going through this process. Meantime, she came back to me. I was just understanding her case, and she said that she developed abscess. Now, this abscess was a very turning point for me for in her case. And the abscess was this thing thick yellow, and initially though it was very painful and red and all, and out of scare she had started antibiotic. So first course of antibiotics she did for 10 days. Nothing happened. The abscess was as it is, and it was becoming bigger and bigger, painful and everything. And then finally, I gave her Calcarea Sulf. Then I thought, now this is the time. I think so. I should give her. I think now, means I was very sure of my prescription that this is Calcarea Sulf. And I gave her 4 doses of Calcarea Sulf. And after giving Calcarea Sulf, the abscess started healing. And in fact, her warts also started shrinking. which were not yielding to any treatment, and it was there since more than plus 1 year plus. Initially, for what she had come to me. So what started shrinking? The umbilical eczema started drying up, and the abscess started draining. So all three levels, all three places, the vital force started healing, and the body started showed beautiful response. So then I continued. Then I gave her a few doses of Calcarea Sulf. Slowly, all warts fell down. Everything was happening good, nice. Nothing happened. And then I kept her on placebo for some time. And then the initial one more abscess she had there, which was dried up because of the antibiotics, the half dried up and half ripened, that also ripened again and oozed out completely. And then a small keloid got formed there, but I didn't intervene anywhere. I just again gave her a dose of Calcarea Sulf, and the keloid also then went away eventually. So this is how, I understood that if we what I will say, if we conglomerate both the things together, you know, physicals and mind. And as we have now more and more, every remedy's mind is becoming more and more clearer to us through rubrics, through understanding, through mineral understandings. So this is how I was very sure of Calcarea Sulf prescription, and Calcarea Sulf eventually completely cured her case, and all the three places she got a complete cure. And she still, now she comes to me for her daughter's treatment, but nothing has repeated. Even after more than 1 year plus, nothing has come back. So this is how I saw Calcarea Sulf case.
Typically, if you see in your case, like all the complaints were of skin,
Yes,
warts were there,
yes,
abscess was there, umbilical eczema was there,
yes,
and everything was chronic in nature. Like how Kent says, when this inflammation gets chronic, we can
yes,
think of bacteria self, right?
yes, yes,
Injuries
yes,
which refuse to heal, long-standing inflammation,
yes,
suppurative tendencies,
and what more?
offensive pus
Yeah.
with lot of yellowish
Yellowish pus
discharges.
and all. And what more, one more thing, I was very strong and continued Calcarea Sulf, because physically abscess was very much the Calcarea Sulf prescription. But then, I could see that the personality is only Calcarea Sulf.
Yes, that's how warts
And
fade out. No?
and that
Otherwise,
hurriedness type of Calcarea Sulfi, she would come last only in my clinic, after at the end of the getting my time period, because she doesn't have to wait, no. That hurriedness was there, which was never told to me, but that was my observation. That And last also, then she'll just call me up if I am winding up at 2:30. She'll just call me up, doctor, wait for 5 minutes, I am just coming.
so
And that friendliness of Calcarea, you know
yes.
that she knew somewhere doctor will wait for me. Because yeah, so that was a very very strong prescription of Calcarea Sulf, and that in fact that taught me also a lot about Calcarea Sulf.
Yes,
Really
very
added to my repertoire of Calcarea Sulf personality, actually.
and very important to see in your case was, see, there was abscess which settled down and eczema came back.
Yes,
There you did touch and it settled down, and then new symptom came. There again you gave just one single dose and things settled down. So it's very important to see when to prescribe, when to wait if old symptoms are coming back.
yes,
And that is
yes,
also a big learning in this case.
yes.
Otherwise, we go on prescribing, changing, either we change potency, we change remedy, and that we lose the case.
Then we lose
So,
the. Yes, yes,
so
true.
very important to see the past history if old symptoms are coming back. then we just have to wait and see what's happening.
Yes,
That is the important learning, right?
true, very true,
Yeah.
very true. Yeah.
So this is what is the small remedy. Actually, very limited data is there, but we actually need this remedy quite frequently, especially in children cases. It's very common because ultimately calcarea is a child and sulfur is bit ahead. So that combination really, I think we need it quite frequently. In Aditi's case, patient said, I respect people, and that is how I also need respect. Like I respect people.
Okay.
That is calcarea of school age. Like they need respect, they respect others.
Yes, very true.
So we have to understand this aspect also. They are child and want to go ahead with the help of parent. That's why in my case, if you see, this child was reacting in front of mother because he was comfortable with mother. But father, who is a masculine figure, strong person, then he used to keep quiet. See the child. And then the sulfur element, how that was added because of the skin things. So that was the learning in these two cases. Aditi, if you want to share anything, if you want to add something to calcarea sulf, or we can,
No, I
uh,
think so. I have said
most
all
of the
important
data we have
points.
covered.
Yes, yes, yes.
So friends, with these two cases, do study calcarea sulf and see. I think you'll get lot of cases in your clinics because it's a very common indicated remedy and very good for skin and related issues. So thank you. We stop here.
Thank you. Thank you all. Friends, do watch our channel and subscribe if you have not up till now. Yes. Thank you.